Hi everybody, John Adamson with Seeking Light. I love how it does these thumbnails. When you go live, it wants you to take this thumbnail picture, and unless your face is right there, it doesn't get you. So you had this thumbnail from like here up. I'm sure you appreciated that. Good look at my forehead. And I've got a fizzy water. So I want to talk briefly about the SCOTUS decision on the CMS ETS. So again, that's for the Center for Medicare and Medicaid Services Emergency Temporary Standards. So a lot of people are celebrating today, as they should, the striking down of the OSHA mandate, and that affects non-healthcare workers. But what was upheld in a 5-4 decision was the CMS ETS, which influences all healthcare workers who work for organizations that deal with Medicare or Medicaid. And anyway, I was reading the decision last night. I read all of the mandating for CMS decision. People like, I'm just doing blanks on names, Kagan and is Kennedy still there? I don't remember. Anyway, it doesn't matter. I know Justice Thomas, not Justice Thomas. He was leading the against. But anyway, the long and the short of it is that SCOTUS, in part, wants to make sure that you are sanitized. In other words, they pulled a bunch of provisions from various laws to come up with their decision. The people that made the decision, like Sotomayor, I'm just blanking on names, but Sotomayor, she should have been a lawyer for the pro-vaccine mandate side rather than a justice sitting on the Supreme Court, because she kept making these wild claims. For example, at one point she claimed that at least 100,000 children had been hospitalized and in the ICU with COVID. And that was wildly inflated number. It actually was something like a little over 3,000 is what the CDC had tracked. But she kept making these points like, oh, this is a pandemic of epic proportions, and we have to do what's right. Not what is legal, which is what the Supreme Court is for, determining the legality of something, but what is morally right. And what she means is ethical. And in my course, which I'm going to be doing on medical mandates soon, and I've put out bits and pieces of it, I talk about how ethics does not equal law, law does not equal ethics. The Supreme Court does not have the right to determine something ethical. They have to determine whether something is legal. And sometimes the two don't overlap. So, for example, somebody like Justice Thomas may decide that, from an ethical standpoint, he doesn't agree with the law. But he will sometimes rule, and he's said this before, against his moral judgment, because that's what he's called to do as a justice. So anyway, what does the SCOTUS want you to do? Well, they want you to be sanitized. So what they pointed to is a number of regulations, especially around nursing homes and hospitals, where they have to have infection control. And so, for a long time, hospitals and health organizations have had to utilize what are called standard precautions and infection precautions. And it's had various names, and you have different levels of cleanliness precaution you have to put into place, including hand washing, the use of PPE. If you have somebody that has a droplet-based respiratory infection, they have to be in a negative pressure room. All of these things are put in place in healthcare to maintain sanitation. And one of the big sanitations, of course, is just cleaning things. And so what the justices were basically saying is that you have to make sure your employees are clean by administering the vaccine. And therefore, and this is something that Justice Thomas totally picked on, and kudos to him, he was totally right, is that the law didn't say that, vaccines had to be administered to the workers to be sanitized. And one of the big things, because of research that is so concerning about that statement by Sotomayor and others, is the fact that there's no guarantee, unlike cleaning a surface, there's no guarantee that a vaccine will in fact prevent a spread of infection. For example, I can clean a surface with approved alcohol-based wipes or spray, and it's very standard practice, and it's proved scientifically. If I clean a surface appropriately, it will kill any pathogen on that surface, 100% of them. Properly cleaned, it'll kill 100% of the pathogens on that surface within a few minutes. 100% guarantee. 100% guarantee. Why is that important that I'm saying it? Because it's not 100% guarantee that just because I get vaccinated, therefore I'm not going to spread the disease. In fact, more and more research showing the potential for both vaccinated and unvaccinated to actually spread the disease. So basically what you're saying is you want healthcare workers to internally sanitize, and yet there's no guarantee it'll actually sanitize, unlike these other things we've put into practice, like washing your hands for 40 seconds now is what the CDC recommends, under hot water with vigorous rubbing all surfaces, proper drying techniques, certain kinds of masks for different things, wearing certain PPE to protect you from splashes that might get infectious material on you. All of these things are guaranteed, if done properly, to significantly reduce the risk of spread. And yet one thing we cannot say in the same vein is the vaccinations will actually reduce the spread to a significant level. One of the things you heard the lawyer for CMS routinely, or I should say HHS, routinely say is that it's the most effective way to prevent the spread. But that's not the case, not proven scientifically, certainly not by the research that's come out recently on vectors of spread. There's even some concern that's been raised, quite a bit, that perhaps even people that get the shot are actually causing spread, even though they might not be infected, because you've got a piece of virus or synthetic virus that you now are carrying that some people have found that can be transmitting. Some studies have been finding to be transmitting this stuff. Sorry, I had to take a sip. So anyway, SCOTUS wants you to be internally scrubbed. And they clearly, just listen to the testimony. If you've got the stomach, listen to that. Also, I would encourage you to read the decision by the Supreme Court. I'm going to be going through it little bit by little bit, but I wanted to focus on that one thing. It's faulty information, and unfortunately is the majority basis for the decision, or one of the pieces they used as coming up with the majority decision by SCOTUS that healthcare workers are still mandated under this ETS. And again, just want to encourage you, though, that it is ETS, Emergency Temporary Standard. And I'm somewhat confident that at some point people will realize we're no longer in an emergency in regards to what they would like us to think, and that it is a temporary standard. But we do need to pray that for the workers that are working in healthcare. And I have friends who are vaccinated, and I have friends in healthcare who don't begrudge me being unvaccinated. And I know some of them are just like stressed because they're being worked to the bone because their unvaccinated friends have been let go in their jobs, and now they're stuck with the burden. And they're going to burn out, and they will get ticked off at some point, and they're going to be told you got to get booster number X, Y, and Z. I guess that's letter X, Y, and Z to keep going for working. And they're going to get fed up at some point. We're going to eventually see a backlash of a number. This video is going to be taken down by YouTube. I know it. I know they're gonna find fault with what I just said, but you know, I anecdotally know that there are healthcare workers that are like, you know what, I'm done. I had my 2, they said that was enough, I'm done. Or I had my booster, I'm done. I already told you that there are patients inpatient at our hospital who are triply vaccinated, 2 plus the booster. We have, last I looked, 1 on vent, triple vaccinated, several in the ICU, several in the hospital, main floors who are triply vaxxed. And what's interesting is, I don't know what you're saying, but the ones that are, the mix of those in the hospital overall, the average age is on the higher end. It'd be into the geriatric category, as we would call it. And that's about equal, vaccinated and unvaccinated right now. It was like 108 patients, 56 unvaccinated. So it's very close to being equal distribution between vaxxed and unvaxxed, and like 8 triple vaxxed. And they count fully vaccinated as 2 shots or more. So anyway, but that was a age ranging of like average age of 77. That was interesting. But the ones in the ICU, they were like upper 50s. And that tells me something. I believe what's going on there, just because I've been working in healthcare for so long. Those are a lot of your super unhealthy people who are type 2 diabetics, obese, have a number of maybe perhaps other comorbidities, and that's what's causing them to be in the hospital right now. In the Omicron variant was just enough to push them over into needing to go to the hospital. So that was interesting. A little bit younger average, but probably a lot of comorbidities amongst that group. Anyway, I've rambled enough. Appreciate your time in watching this. If you have any comments, suggestions about future videos, let me know. I've got one more to do with my ethics course for you guys. And then I'm going to be revamping it a little bit, because I'm going to delve into the ethical principle more of veracity. Veracity is telling the truth, truth-telling. And I've been thinking about more aspects of how we're not getting the truth, and how do you promote the truth being told. And so I've got some ideas of how I want to change it around a bit to make it flow better, and then just touch base a little bit more on veracity, because without a basis of veracity, I'm just thinking about this right now. I think I might even cover it first. Without the basis of veracity, you cannot look at what is beneficence, which is doing good for others. You have to have a basis of truth before you can determine beneficence. You also have to have a basis of truth before you can determine what is non-maleficence, which is not doing any harm. First, do no harm is the principle. So unless you have that basis of truth, those are gone. Those 2 things are gone. And so I'm going to spend a little more time on that, I think, in my course. Anyway, we're about to have a snowstorm here in the east. I hope you're safe. John Adamson, Seeking Light. Take care. God bless.